Here we are to discuss brucellosis now. And brucellosis, it is caused by obligate aerobic fastidious, non-sporing, non-motile, non-capsulated, small gram-negative cocobacillus called Brucella species. The brucellosis is often called undulated fever because of its fever pattern that comes comes and declines in wave-like patterns, and human infections are often associated with occupations of domestic exposure to the infected animals. And four species are pathogenic to humans: Brucella abortus, Brucella meritensis, Brucella suis, and Brucella canis. It is actually a contagious febrile illness. And besides brucellosis and undulated fever, it used to be known as Mediterranean fever, Maltese fever, Crimean fever, Bang fever, and so on. So epidemiology, to discuss epidemiology, the incidence varies across the world. It is 0.03 to 160 per 1 lakh population per annum, and it is more in developing countries than developed ones. It is common in Mediterranean countries like Balkans, the Persian Gulf, Middle East, and Central and South America. The most common animal hosts for different species are so for Brucella militensis, biovar 1 to 3, sheep, goats, camels, and buffaloes are the most common animals. Brucella abortus, biovar 1 to 6, bison and camels are most affected ones. And by Brucella suis, biovar 1 to 5, most commonly affected animals are pigs, reindeers, and rodents. And Brucella canis, it affects most commonly the dogs. So antigenic structure includes two types of lipopolysaccharide antigens, namely M and A, that are present in varying proportions. Brucella militensis, it consists of M antigen predominantly, and Brucella abortus, it consists of A antigen predominantly, and Brucella suis, it might contain M antigen or A antigen predominantly. And the pathogenesis includes, first of all, it is transmitted through the routes of foodborne, direct contact, or airborne, and it spreads through the lymphatics to the local lymph glands, and in there they are engulfed by phagocytic cells, where intracellular survival of the organisms with the help of different virulence factors plays a very great role in their pathogenesis. And for example, the cell-wall lipopolysaccharide, type 4 secretion system, copper zinc superoxide diamutase, nucleotide-like substances, etc. They help to escape the phagolysosomic oxidative killing inside the phagocytes, and from there, from the lymph nodes, local lymph nodes, they get spilled over to the bloodstream after they have multiplied to a certain level, and through the bloodstream they are disseminated throughout the body to involve various organs. So here is a picture that shows Brucella abortus. The humans can get infected with contact with animal and animal byproducts, animal products that can be ingested. For example, milk, contaminated sheep and goat milk, they are leading source of human infection. And once it gets inside the system, it will be ingested by polymorphonuclear cells, macrophages, and dendritic cells from in the lymph nodes. From there, with the help of always flowing bloodstream, it reaches to the organs that are rich in mononuclear phagocytic cells, for example liver, bone marrow, spleen, lungs, etc. And there they start showing their manifestations. So the clinical manifestations, they can involve any organ or system. Classical trait of fever with profuse night sweats, arthralgia or arthritis, and hepatosplenomegaly is seen. Typhoid-like illness is common, except that brucellosis is less acute than typhoid, and it is less severe with undulating fever in contrast to the step-ladder fever in typhoid. And musculoskeletal symptoms are more and involves half of the patients, and it may mimic skeletal tuberculosis. The other non-specific symptoms include abdominal pain, headache, diarrhea, rashes, weakness, weight loss, cough, pharyngitis, etc. And rarely, central nervous system and cardiovascular system and genitourinary tract may also get involved. So laboratory diagnosis. Before laboratory diagnosis, detailed history, it plays a very important role, and which should of course be always be followed by laboratory techniques. So sample can be blood or bone marrow. It can be cultured, and culture characteristics. To discuss about culture characteristics, the growth is very scanty and slow. Blood volumes 5 to 10 ml can be taken, and multiple sampling can help can help to increase the sensitivity to a better level. And culture media, biphasic media is superior than monophasic media. The picture shows a biphasic media, Castaneda media. And automated techniques like BacT-Alert or BacTech, it guarantees better recovery rates than other methods. And so total time of incubation is 4 to 6 weeks. At least 4 to 6 weeks of incubation is required. And on solid media, colonies are small, smooth, transparent, low convex, with entire margins are seen. And in gram staining, small gram negative cocobacilli are seen. So they are non-motile, catalase positive, oxidase positive, and urease variable. These biochemical tests are useful in identifying the organism, and serological tests can be useful because isolation is difficult, as we have already discussed. So standard agglutination test is gold standard, and complement fixation test and ELISA can be used. So molecular methods includes PCR using primer for RRS, RRL gene, outer membrane protein 2 gene, the insertion sequence IS711 can be used, and guinea pig inoculation is another not routinely done laboratory method. Diagnosis in animals can be done with the samples of milk and dairy products. They can be cultured, or antibody detection can be done in milk ring test, rose bengal card test, whey agglutination test can be done.